Welcome to JPHMP Direct TALK. This episode features Mr. John Auerbach, MBA, CEO of Trust for America's Health, and a member of the editorial board for the Journal of Public Health Management and Practice. This interview highlights Mr. Auerbach's editorial in the July-August 2018 issue of JPHMP called Deaths of Despair and Building a National Resilience Strategy. This editorial is in response to the Pain of the Nation report released by Trust for America's Health and focuses on the triple epidemics America is facing, with deaths from drugs, alcohol, and suicide, and how we as a nation must build a national resilience strategy in order to end these grave issues.
Hi, Mr. Auerbach. Thank you so much for being here today with me to discuss this very grave issue our country has and continues to face. I really appreciate it.
My pleasure.
So what I would like to discuss with you today is in regards to the editorial you wrote called Deaths of Despair and Building a National Resilience Strategy. I've done some research in the substance abuse field. My education is along the lines of that, so I really enjoyed reading it and would love to hear your thoughts regarding this editorial you wrote.
Oh, great. Let's get going then.
Okay. Can you tell us a little bit about your previous positions working in public health and, what prompted you to take on this role as president of Trust for America's Health?
Sure. Well, I've worked in public health for a few decades now, and I started out working in a community health center in the neighborhood that I lived in. It was just starting. It really gave me a sense of the importance of working at the community level to make change. And then over the years, I took other positions in government. Started as an HIV director for the state of Massachusetts. I later became the city of Boston's health commissioner for a decade, and then the state health commissioner in Massachusetts. After that, I worked at the Centers for Disease Control, overseeing policy and, for a period of time, relations with local, state, tribal, and territorial agencies. Within each of those jobs, I learned a significant amount of information about substance misuse and mental health, and the importance of incorporating into public health a sensitivity towards working on those issues and understanding how those issues often are very much connected to other public health issues, from infectious disease to motor vehicle accidents to domestic violence. And so it seemed very natural to me to work at Trust for America's Health on the issues related to substance misuse and suicide.
Great. Yeah. I think a lot of people don't understand the importance of public health. Even myself, since I have more of a research background, I wasn't so familiar with public health until I took on this current role working with the journal. But it is unbelievably important to understand that, research is one thing, but the public health professionals taking that information and implementing it in the community it's just of huge importance.
Absolutely agree. And I think that public health are the practitioners. They're on the front line and need to have the tools to make the biggest impact. So reading the articles and the research that are in the Journal of Public Health Management and Practices is one of the ways that people in the field can improve their ability to affect the population, the health of the population. So there really is a connection, I think, between the research, but then the frontline practitioners understanding that research and using it on a day-to-day basis.
Right. So this Pain in the Nation report that was released, I think the first report was in November, if I'm not mistaken there. And so this editorial you wrote that is based off of the information from that report. Was there anything particularly alarming that kind of made you decide to write this editorial and get that information out there?
Yes, it was looking at the trends over the last decade and being incredibly alarmed about the impact of these three conditions and diagnoses on the health of the public. When I was at CDC, we would track the major causes of illness, and in general, we were seeing that the major causes of illness and death in the country were either leveling off or were decreasing: cancer, heart disease, etc. But what we saw was moving in the opposite direction at an alarming rate were deaths from drug overdoses, alcohol abuse, and suicides. And there was more and more attention that was being paid to those particular issues, particularly the opioid-related drug deaths. But there was less of an awareness that the three different causes of death had a lot in common with regard to the risk factors associated with them and the preventive activities that could have a positive impact. We felt that, that given the alarming impact of these causes of death, namely 1 million people died in the last 10 years, and the indications were as many as 2 million would die in the next 10 years, we felt like we needed to take action, and we needed in particular to focus on prevention.
That is an unbelievably alarming number, that 2 million. You mentioned when the report first came out, the projected increase was 1.6 million, and then when you reevaluated these numbers, it was actually 2 million, which is a huge jump.
Right. We wrote the report, as you mentioned, initially the major report, Pain in the Nation, was released in November 2017. In early 2018, we received the latest death indications for those three causes, and the numbers that we received in early 2018 were so alarming that they meant we had to take another look at the projections and adjust those projections upward to reflect more deaths than we had anticipated.
If you talk to a lot of people today, they think that this epidemic is largely affecting whites, which is not false, but although blacks had relatively low drug overdose deaths between 2015 and 2016, there has been a large increase, about 40% for the black populations in drug-related deaths. Do you think this is predominantly due to the increased prevalence of synthetic opioids out there, or maybe those risk factors that you mentioned previously?
Well, before answering that, I would just really emphasize how extraordinary the data that we saw in early 2018 was, because as you say, we saw dramatic changes in terms of the impact on the African American and the Latino population. It was already high among the white population, but to see a 40% increase in African American deaths and a 25% increase in Latino deaths in 1 year was startling. 1 year. Because we're accustomed in public health to see at times changes over several years. But to see something so dramatic in a 12-month period was further indication that this is really a crisis. When we looked at the data about what happened during that 1 year period, we did see that the largest number of deaths that occurred were in drug overdoses, and the largest cause of those, the main cause of the drug death was due to the synthetic opioids, fentanyl and carfentanil. That was also something that was new. In previous years, prescription opioids were associated with the largest number of deaths. So again, to see a very dramatic change in 1 year with regard to the drugs that were leading to overdoses was very alarming, along with the increase in terms of those other racial and ethnic populations.
Yeah, just so people who are listening are aware, carfentanil, synthetic opioid, is used to tranquilize elephants. When people hear, synthetic opioids, people are familiar with fentanyl. It's used, in patches for cancer patients, but carfentanil, that's used to tranquilize elephants. So the fact that there is that increased prevalence and it's causing that soar in drug overdoses is absolutely alarming. We have that around, and people are getting their hands on it.
That's true. And, some of the people who have been addicted for some period of time were aware of the doses that they could tolerate, for heroin or for prescription opioids. But when mixed in with the drugs they were familiar with, sometimes without their knowledge, some of these other synthetic opioids like carfentanil, that could dramatically change the potency and toxicity of the drugs that they were using, sometimes resulting tragically in their death. But the other thing I would say about fentanyl and carfentanil is that there is indication that a good deal of the fentanyl and carfentanil that is in circulation is not prescription fentanyl or carfentanil. It's illicit synthetic drugs that are made in laboratories, sometimes in other countries, and that therefore there isn't any particular standard that is followed, no quality standards that assess the contents of the drugs. They could look the same. You could have carfentanil that was stronger and carfentanil that was weaker because it's coming from all different types of illicit laboratories that make it very difficult for us to estimate anything about how much was used and where it came from.
Right. So thankfully today, more states, as you have mentioned in your editorial, are enacting the Good Samaritan Law. So for those who are not very familiar with this, basically those who are found with a substance on them, and in particular with drugs, it's 1 gram of cocaine or heroin, they won't be prosecuted for this. So it hopefully will make someone who is assisting someone who's overdosing to make that emergency call. For people who are very far in their addictive phase, so to say, they might have more than 1 gram of cocaine or heroin on them. And as you mentioned, heroin today is adulterated with fentanyl and carfentanil, and that user might not be aware of this. Do you think that this may affect the willingness of individuals to seek help from someone who's overdosing? So in other words, do you think that the Good Samaritan Law might be too limited in some states?
Well, I think that's the kind of thing that should be monitored and should be investigated by public health departments that have close connections to people who are injection drug users or family members of injection drug users. Because as you say, the intention of the law is to encourage people to save the life of someone who is overdosing by calling 911 and increasingly often administering naloxone to help reverse the impact of the overdose. We certainly don't want people to hesitate calling because they're worried that they could become arrested themselves. We know that if that is the case, that will lead to people dying because assistance won't be sought. So paying good attention to that, listening to the people who are closest to the ground on this work, and if necessary, proposing some changes to those laws and regulations does make sense.
So since we're well aware that we're not going to arrest our way out of this problem, as so many people say, if you're familiar with drug treatment court, for those people who still do get arrested, but there are communities that have drug treatment courts implemented, so those who are charged with nonviolent misdemeanors and low-level felonies can basically be put on intensive probation and get addiction treatment rather than be incarcerated. They still have to adhere to submitting regular drug tests, and they hopefully will be able to avoid jail time if they successfully complete the program. And I know a lot of people are not familiar with drug courts. Do you think that is something that you might recommend to promote the harm reduction aspect of this national resilience strategy?
Certainly. There's a good body of evidence that those courts can be very helpful in terms of addressing the underlying cause of the person finding themselves in trouble with the criminal justice system. Very often people are arrested and incarcerated for relatively low drug-related crime, and what can happen is there can just be a revolving door of being in prison, being released, using drugs again, then being involved with crime, and then being rearrested. What the drug courts attempt to do is break that cycle by offering an alternative route for the people involved, and that is addressing their underlying cause of the criminal behavior. And again, the research has shown that for some people, it's not for everyone, but for some people this proved very effective in getting them on a different life course where they've controlled their addiction. They often can be assisted in terms of reconnecting with their family, getting job training, developing taking the kind of steps that will help them to break that cycle and rebuild a life for themselves that is healthier.
I completely agree with that. I love the idea of drug courts because a lot of individuals, the root cause that might have fueled their addiction could stem from childhood. And today it's gained a lot of popularity using these adverse childhood experience questionnaires, as I'm sure you're familiar with, just basically assessing traumatic or stressful events in people's early childhood. And these can include growing up with family members who have substance use disorders, so their behaviors might just emulate those people who they've been around with their whole life. And if they commit some petty crime or, something that is not necessarily nonviolent, but they get thrown into jail, they're not learning how that behavior is not acceptable. So with the drug court idea, getting them into treatment, identifying those root causes that might have contributed to their addiction, I think that would be very beneficial. With these adverse childhood experience questionnaires, so you mentioned in your editorial that we should take some more upstream interventions, and there should be a focus on early identification of issues and connections to care. What are your thoughts on administering these questionnaires in schools, maybe starting as early as elementary school or middle school, and then following up with that afterwards?
I think it is important for clinicians and social service providers to be sensitive to the negative impacts of adverse childhood experiences and trauma in the lives of children, adolescents, and it can happen as an adult. Many of our veterans who are returning from war have the symptoms of trauma that is not unlike the kind of trauma that people will experience if they've had very difficult childhood. So it is important that healthcare clinicians in working with families try to identify those adverse childhood experiences as early as possible and begin to think about how to intervene with the families and the children themselves. Adolescence is a key time to pay particular attention to that, as is young adulthood. So I think how to best do it depends on the circumstances. Increasingly, we're seeing clinicians who are screening for those in the context of providing healthcare services, being what's sometimes called trauma-informed. And schools are also examining how to be trauma-informed and sensitive to those kind of causes, behaviors. How best to do it really may depend upon the circumstances. Schools, for example, may not routinely do screening. They may find it more helpful to be looking for certain behavior that has already occurred and then working with the family to determine if there are causes that may have encouraged that kind of behavior that they should begin to be sensitive to. But the overall awareness of the impact of adverse childhood experiences, the overall awareness of the impact of trauma, and the incorporation of trauma-informed and sensitive systems needs to occur in schools as well as healthcare facilities.
Yeah, the school environment is absolutely critical. Children are more often than not spending most of their time in the school environment rather than, even at home with their parents. Like you said, it's a very loaded question. If we can tackle the issue during early childhood, adolescence, then that could hopefully help prevent that vulnerability to succumbing to abusing drugs.
Sure. I think that, part of the challenge is making sure we're thinking about this comprehensively, because we don't want schools and clinicians screening, finding out that these issues exist, and then not knowing what to do with them. Now that we know that, what do we do? We want to make sure that there are systems that are put in place which identify the referrals that can be made to people who have special skills to address the issues that arise. We want to make sure that people in schools get the adequate training that they need to understand how to ask the right questions in a sensitive way, how to work with families, how to respond when issues are identified. And so working in a comprehensive way is critical in order for this to be beneficial for the children and their families.
Yes, that word comprehensive, I think I think that stands out the most to me. So to summarize the points made in your editorial, what would you suggest are the immediate actions that should be taken?
I think we need to work on multiple fronts. One important area to work in is within the healthcare delivery system, because we think that too often the healthcare providers will focus on the physical illnesses or the physical conditions and not pay as much attention to those that are behavioral, substance abuse or mental health related. And more there's an effort to incorporate into the provision of primary care sensitivity and expertise for behavioral health. It definitely has such a critical role for physical health. It's difficult to separate that. So working in the healthcare arena, developing services that can be referred to and services that are routinely incorporated into care, critical. A second area of work has to do with working with children. And that means, as we've talked about, working in school settings as well as community settings to work with not only families but other organizations within the communities. That can include the church, recreation centers, sometimes the police, community groups, grassroots groups that have an interest in creating the conditions which make it more likely that children and their families will be resilient and be able to resist the risks associated with suicide and addiction. They need to have tools, namely the information about what works. They need assistance in terms of sharing information throughout the community, and they need assistance in terms of creating activities that are useful and helpful for families, recreational activities, sports activities, activities within the schools that address conflict resolution or identify unhealthy behavior and begin to try to address that at the early stages. So that there's a whole bunch of activities that are related to working specifically with children. And then, of course, there's a range of different services that are needed for people who have already developed addictions. And that stretches all the way from the administration of naloxone when people are overdosing, those Good Samaritan laws that we were talking about earlier, drug courts, and access to the full range of different treatment opportunities, which sometimes requires residential care for extended periods of time. So that may give some sense of the range of different activities that really stretch all the way from when someone is in danger of overdosing to back to what happened in infancy, childhood, and the early stages of life that can either position a child to engage in unhealthy behaviors or insulate them from that with a number of different supports.
Right. Basically make our environments a little bit more enriching for kids, not throw technology on them with all this social media that is becoming all that they know, and make environments a little bit more enriching for children.
So the other thing I'd mention is that we also, it's really important to focus on children, but we also know that adults face traumatic circumstances and real challenges in their life when there is an elevated risk of substance use, mental illness, and even suicide. We saw that a few years ago in Scott County, Indiana, where there was a dramatic increase in the HIV infections within that rural county. And when the public health officials went into the county to better understand what was happening, they found a very high percentage of the residents in that county were injection drug users. And when they talked to people in the county about why that was the case, they heard essentially these stories of despair, high unemployment, a lot of dropouts from school, a lot of poverty, little hope for the future. And what those public health officials realized is it wasn't enough to give people the HIV and substance abuse treatment services. They also had to pay attention to what was causing this despair. And those social and economic, sometimes discriminatory conditions lead people to unhealthy behaviors. And part of what we in public health need to be aware of is working on the social determinants of health as well as working on behavioral change.
So with focusing also on adults, as you mentioned, I'm thinking about the huge problem we have with alcohol misuse today. And I mean, there always has been a problem, but as we see, it's really fueling this epidemic is alcohol use. And there seems to be an increased trend with the availability of alcohol in all forms. You can go to a cafe and get alcohol put in your drinks, or go to an ice cream store. And people share this all the time on social media with how amazing this is that they can get spiked chocolate ice cream. Do you think that we're promoting the use of alcohol too much? And, you know, even among adults, we're able to drink if we're at least 21 years of age, but are we making it too socially acceptable and not realizing that alcohol misuse and addiction is a huge problem?
Well, alcohol, in moderation, for adults, alcohol is not a problem. It really becomes a problem when people are drinking excessive amounts and when they're drinking and then engaged in high-risk behaviors like driving or other such behaviors. And there is evidence that if you make alcohol too readily available to people, then they're more likely to use excessive amounts of it or use it inappropriately. So for example, if you live in a neighborhood where every other store seems to be, an alcohol, seems to be selling alcohol, then it's more likely you will use it. If the price of alcohol is very inexpensive, it's more likely you will use it excessively. There is growing attention to not only making people aware of the dangers associated with alcoholism, but also looking at the public health interventions that might be effective. Those include pricing approaches. When alcohol is more expensive, people are less likely to abuse it. And they include communities that have tried to do more zoning restrictions so that there can only be a certain number of liquor stores within a particular community. And I think it's good to look at the wide range of interventions that may be helpful with regard to alcohol abuse, and using those public health skills, determine which ones seem to be most effective, and then work with community leaders to consider those.
Great. Thank you for that response. I mean, I could keep you here all day and ask you questions, but I want to respect your time, and I know that you're busy protecting America's health. Do you have any final thoughts that you would like to share, or any comments based on your editorial?
I think that this is an epidemic that needs many different approaches. We cannot end the excessive and tragic deaths with just one or two approaches. We need to have many different ones in a comprehensive strategy. We focused as a country our attention in some important areas like changing the inappropriate prescribing of opioids and increasing access to drug treatment and distributing overdose reversal medications. Those are good steps, but they're not enough. We've seen movement away from prescription opioids to the synthetic opioids, and we've seen that drug treatment in many communities just isn't as widely available as we would like it to be. We have to start thinking about how did we get into this dilemma to begin with, and working more and more upstream with folks are at an elevated risk from things that happen to them in childhood and adolescence or as adults, and put in place educational materials, services, skill building, access to support systems, and attention to the social determinants of health if we're actually going to reduce this alarming increase of deaths over the next decade and get a meaningful handle on these three causes of death.
Thank you so much, John, for your time and answering all of my questions. I really appreciate it.
Well, thank you. I'm so glad that you're interested in this issue and that you're going to help to get the word out.
This concludes today's special feature with Mr. John Auerbach. Learn more about this and other related topics by reading the July-August 2018 issue of the Journal of Public Health Management and Practice online at journals.lww.com/JPHMP.